Hello, my name is Shauna with the Supportive Employment Program. Today we are interviewing Ms. LaQuanda Nicholson, who is a patient registrar at Essentials. I will take it away. So some things that I would like to ask you are, what is your career?
My position at St. Joseph's Hospital, part of Ascensions, is a lead registration. So I'm one step under the supervisor. I handle a lot of the different things in the department.
Okay, perfect. How long have you been in this field of work?
I've been in this field of work for healthcare for 20 years now.
20 years. Wow, that's a long time. What led you there? Like, what kind of what sparked you to take that position?
After being in the insurance industry for 22 years, I wanted to make a career change. And at that particular time, I thought healthcare would be the better career change to make because under circumstances, you're always going to have sick people.
Okay. What did you need to get there? Was there any school, any certification, any test, any years of experience? Kind of tell me what education or what schooling or what different things or certification that you needed.
Being in the healthcare industry for 22, being in the insurance industry for 22 years, going into healthcare and in that particular position as a registrar, that was a big thing back in the day because insurance is very important in the registration department. So far as testing, I didn't have to do any testing or do any kind of extra courses or anything for the position.
Perfect. So you didn't have to have any education. Basically, everything. There was a lot of on-the-job training. You were able to um, transition and use some of your insurance knowledge in this particular position to kind of help guide you in this position as a registrar.
Yes.
Did you face any barriers with getting this position, or was there anything that was difficult, or was there anything that was maybe a challenge for you?
So far as getting the position or once I got into the position?
Once you for getting the position, were there any barriers?
No, there were any barriers for me at all because I had a good work history.
Okay. Now, once you got the position, were there any barriers?
A barrier that was for me was being able to having to collect money from co-pays and from patients. I never had to experience anything so far as having to take money from individuals. So at first that was a hard thing for me to do, but once you figure out the verbiage that you need to use and how to approach the patient in order to get them to pay their co-pays, it became an easy task for me.
Perfect. Did anything surprise you about this journey? Was there anything that surprised you? Anything that you didn't know that you found out with taking on this position?
I think the biggest thing that really surprised me with the healthcare is I was totally surprised of the number of people that don't have primary care doctors. And I thought that was really surprising because if you don't go to a doctor, if something is going on with you, you don't know. So not having a primary medical doctor, I think, was a big shocker to me.
Was there anything else that was a surprise to you on this journey with starting to work in a hospital? Was there anything that was different from or unusual from what you were previously involved in? I know you said you worked in insurance, so I'm pretty sure that that was a Monday through Friday. So can you tell me about that transition that maybe happened, you going from a Monday through Friday job to possibly, working in a hospital and working weekends? Can you tell me about kind of how that was for you?
That was a big challenge because I've always worked a Monday through Friday office type atmosphere. And that was a big transition having to go to working every other weekend, working holidays, and also dealing with the public. working in the insurance industry, you're not dealing with the public. You're more or less kind of behind the scenes. And being kind of shy, that was a big challenge when you're having to deal with the public, because you're dealing with all kind of personalities, all kind of attitudes, and you're there as being service to the patients.
What would you say was one of your biggest success with working at the hospital? What would you say was one of your biggest success? Something that you did that was a huge success in that role.
Well, one of the things was I worked hard to achieve where I am. And only being with the organization for 2 years, I was right away promoted to a lead, which is a big thing in the registration department, because at that time they didn't even have leads. They just had seniors. But being promoted to a lead, um, always whatever I was asked to do, I did. And this is how you move up the ladder. You can always learn something different.
Absolutely, absolutely. Um, is there anything that you would do different if you could change this? Is there any regret? Is there anything that you would do differently in this role or to get this position? Is there anything that you would do differently?
No, there was nothing I would do differently, because I love what I do. You know, no one day is the same. Every day you're meeting different people, and I've become a people person. I love talking to people, so no, I love my job. There is nothing that I would change, take away, or add. I love what I do.
And how long have you been in this role or this particular field? How long have you been doing this?
Um, 20 years.
Okay, so you've been doing this quite a long time. So you've been doing this for 20 years. Um, can you kind of explain kind of what a typical day is like for you as a patient registrar?
My day starts with, I have a lot of reports to do. Being a lead, uh, you have more tasks and reports and things that you do than the normal registrar. Um, Typical day starts with greeting patients when they come into the facility, directing them where they need to go. Um, Sometimes just talking to patients. Patients come in, they're down, they're sick, they don't know what's going on with them, and giving encouraging words to patients, that makes my day, because I have really felt that I have helped someone.
Sounds good. So it sounds like in this role, you also do a lot of encouraging, you also do a lot of building up, trying to give people a positive outlook when they are feeling down. What would you say is the most interesting part of your career? What would you say was the most interesting part? What is really interesting to you about this particular job?
What would be really interesting about this particular job? Again, you really don't know the need of people until you work into healthcare in positions like this. You'd be surprised people's struggles, and trying to educate patients and encouraging them to get a primary doctor, encouraging them to keep themselves checked, go to the doctor, take your medication, um, to live longer and a healthier life. And this is part of the job too, talking to patients, because a lot of people are not educated when it comes to health.
Yeah, I could imagine, and also too, people not knowing and not being familiar with their insurance, not knowing different things of what's covered. Um, so, what is your knowledge as far as what would you say to people, to some of the young people that might be interested in going into the medical field, but maybe not necessarily wanting to do like the nursing, wanting to do, maybe they want to do something like this, maybe they want to do like behind the desk type work in a hospital. What would be something that you would tell someone if they decided that they wanted to be in the medical field, but they didn't want to do hands on? They kind of wanted to do clerical, behind the scene work. What advice would you give them?
The advice that I would give them is be the best that you can be. Work hard. Set yourself some goals. Have your mind set on what direction and where you want to go in life so far as a career. If you work hard at it, sky's the limit. You can do whatever you want to do. Get your education. Education is very important. A lot of times, just to get into jobs in the hospital, all you need is a high school education. So if you get that diploma, you can go just about anywhere you want to go. Once you get into these places, take advantage of the different programs that's offered to you, where you can move up the ladder. If they offer CNA classes, if they offer classes to better yourself in the healthcare, take advantage of those programs that's being offered in your career.
Perfect. So it sounds like too, in working in the hospital setting, there's a lot of growth. There's a lot of being able to move up the ladder. There's a lot of change. There's a lot of opportunity. You get to meet so many different people. You kind of get to tap in to a lot of different departments. So it sounds like that, working in this field, you get to meet a lot of people.
Definitely.
You get to be around a lot of people. You get to help people. And you also get to educate people on, some things that they might not know, such as, knowing your insurance, knowing, what you qualify for and what you don't qualify for. And my next question is, what is the passion and the interest that drives you, that kind of keeps you, in this position? I know, definitely with this position, you definitely have to have, be a person that enjoys talking with people, directing people, being part of people even when they don't feel good, even sometimes, being on that front line, of being able to help people and assist people, even when they're not feeling good, on a good day for them and on a bad day for them. So what's the passion and the interest that drives you to keep this career? Is it the people? Is it working with the people? Is it educating the people? Kind of what's the passion or the interest that that kind of drives you, that keeps you in this position?
Again, dealing and working with the patients, giving encouragement to the patients, educating them about the importance of health care, the importance of having a primary doctor, and also letting them know that they're not in this alone. There's always hope. And when I leave there at the end of the day, I feel good because I felt that I have helped someone. A lot of people come in, they don't know about their insurance. They don't know what type of insurance they have. And being able to tell them the type of insurance they have, where they can go, even down to the basis of what your insurance would cover, what's in network, what's out of network, where you can go, getting your prescriptions. It's a beautiful thing when you realize that you've reached out and helped people at the end of the day. So this is what I get joy out of doing, talking to the patients, encouraging them.
Perfect. So it sounds like, you do a lot of educating, you do a lot of building up, with patients and educating them on, things that they don't know, greeting them, being that smile, when they enter, the hospital, despite how they're feeling. Is there anything that you would like to say to the young people, if there is someone that is, interested in this particular field of work, is there any encouragement that you would like to give them? Any words of wisdom? Anything that you would like to say to any of our young people to kind of motivate them for this particular career pathway?
Again, whatever you set your mind to do, be the best that you can be. Always be a go-getter. Whatever is offered to you or asked you to do it. Because that's more that you can put on a resume. Never say no. Do anything that's asked of you to do. Get that education. At least get that high school education. Sky's the limit. Once you get into an organization, there's all kind of opportunities and programs that's offered within that organization. Take advantage of that. Take advantage of it.
Absolutely. We thank you for your time. If any of the young people are tuning in, there are definitely different ways that you could go in the medical field. As far as being patient register, being that smile, that person that greets the people when they do come in the hospital. So we thank you, Ms. Nicholson, for your time.